Hello, welcome to JAMA Health Forum Conversations. I'm Dr. Sandro Galea. I have the privilege of serving as Dean of the School of Public Health at Washington University in St. Louis. I also serve as Editor-in-Chief of JAMA Health Forum, a peer-reviewed open-access online journal focused on health policy, healthcare systems, and population health, one of 12 specialty journals in the JAMA network. This is a time of uncertainty for healthcare in the U.S. In 2010, President Obama signed the Affordable Care Act, bringing healthcare to millions of Americans. But the law faced political pushback, culminating in efforts by the first Trump administration to significantly scale back the law. President Trump has said he will protect Medicare and Medicaid and did not make ACA repeal a centerpiece of his campaign. Yet, many in his governing coalition have expressed a wish to cut federally subsidized health coverage and have detailed plans for doing so, some in the Heritage Foundation's Project 2025. These challenges cause us to ask, how can we protect and expand health coverage in the U.S. in the face of political headwinds? And how can we reform the existing system to ensure it delivers better health for all? To help answer these questions, I'm joined today by Larry Levitt. Larry is the Executive Vice President for Health Policy at KFF. In this role, he oversees KFF's work in a range of health policy areas, including Medicare, Medicaid, the ACA, and global health. Prior to joining KFF, he served as Senior Health Policy Advisor to the White House and the Department of Health and Human Services, where he worked on the Clinton administration's Health Security Act, among other health policy initiatives. Thank you for being here, Larry. Great to have you.
Thanks for having me.
So let's start with the most recent election. So in the 2024 presidential election, health reform was conspicuous by its relative absence from the national debate. Why do you think health reform was not a central issue of this last campaign?
This was the first election in quite a while, really in decades, where health reform was not front and center. We had the debate over the Clinton plan, which I was involved in. We had the debate over the Affordable Care Act or Obamacare, over repealing the Affordable Care Act. And, really this election was the first time when we were not debating these issues front and center in the campaign. And I think there are several reasons for that. One is that Republicans' effort to repeal the ACA in 2017 was an epic failure and likely led to them losing control of Congress after that. And I think many Republicans just did not want to return to that debate. And in fact, the Affordable Care Act has been very divisive and controversial since it passed. And it was really at the moment when Republicans tried to repeal the ACA that the public grew to realize what they could lose, and support for the ACA has only grown since then. So there were moments in the campaign where I think President Trump brought up the issue. He referred to him having concepts of a plan for replacing the ACA, but never detailed what those concepts would be. But I think the reality is Republicans just did not want to talk about healthcare in this last campaign.
Well, I think that leads well into my next question. So we're in a pretty complicated moment right now in the second Trump administration. On the one hand, President Trump has often pledged to protect Medicare and Medicaid, yet he tried to roll back the ACA in his first term, and there are many within his coalition who support cuts to federally subsidized health insurance. Now, you wrote a bit in JAMA Health Forum about this climate of challenge and uncertainty. So what's your view of the current state of play about healthcare in the country?
Yeah, uncertainty is certainly the right word for it. We are not going to have a debate over repealing the ACA like we had in 2017, at least not in name. But many of the same issues that were central to that repeal debate are central now as well. Congress just passed a budget resolution, which will start a big debate over tax cuts and spending cuts. And Medicaid cuts are a huge part of that. There's pressure to help pay for the tax cuts with spending reductions. There's a general feeling that Medicare and Social Security cuts are off the table. That leaves Medicaid with a big target on its back. And in fact, the budget resolution targets the Energy and Commerce Committee in the House, which has jurisdiction over Medicaid, for $880 billion in cuts over the next decade. And the vast majority of those cuts would come from Medicaid. Parallel with this discussion over Medicaid cuts is a discussion about the future of the ACA. In 2021, the amount of premium financial assistance that's provided to people under the Affordable Care Act was increased, and that's led to a doubling of enrollment to 24 million people. That enhanced premium assistance expires at the end of this year. So if Congress doesn't extend that premium assistance, people will be faced with huge out-of-pocket premium increases of averaging over 75%, and millions more people would likely be uninsured.
So that leads well to the next question as well. Taking a step back, what do you see as the key challenges to improving health systems in this country, and how do we make these systems work better to the end of better health?
Yeah, I mean, one key challenge is affordability. That really is central to this current debate, but also our longer term challenges in the US. And you can look at it on several different levels. First is just the high cost of healthcare in the US on a systemic basis. We spend double what other countries spend on average, high income countries on healthcare. And frankly, we get less for it with poorer outcomes. But then that filters down to the cost of healthcare to the government, to the federal government, to state governments, the cost to employers, and of course, ultimately, the cost to patients. And many of these government programs that we've been talking about, Medicaid, Medicare, Social Security, certainly they cost the government money, but they improve affordability for people. And there's something of an inverse relationship between what the government spends on healthcare and what people have to spend out of their own pockets. I'd say along with affordability, another big challenge is complexity. I wrote a piece about that in JAMA Health Forum several months ago. And in many ways, the complexity of the system, how hard it is to navigate it, to get access to care, to even sign up for insurance to begin with, especially government programs like Medicaid, Medicare, and the Affordable Care Act, that complexity ends up impeding people's access and affordability.
So let's talk more broadly about the various federal agencies and scientific institutions that now face cuts under the administration. Can you talk a little bit more broadly about how these cuts, perhaps I'm even more interested in the cuts to the agencies and the institutions that people might think of less being directly related to health, and how these cuts pose challenges for health and healthcare?
Yeah, absolutely. Just in the last few weeks, we have seen reports of massive layoffs at the Department of Health and Human Services, reducing the federal workforce at HHS by a quarter, 20,000 people. And many of these cuts will not impact people's everyday lives immediately, but they certainly will in the long term. And I would point to a few areas where I think that will be the case. One is cuts at FDA, which approves new drugs and new medical devices and ensures that they're safe. The cuts will maybe call into question FDA's ability to do that, but also slow the whole process down and slow the ability of new drugs and medical devices to get out to patients. The other is in research, huge cuts at NIH. NIH is involved in, frankly, the vast majority of new drugs go back to the basic research the National Institutes for Health funds and does, and that could hurt innovation in the future. There's other kinds of research that may be less apparent to people. So, for example, there's an agency called the Agency for Healthcare Research and Quality, which is being eliminated through these cuts. I mean, that's an agency that looks at ways to make the healthcare system better, to make it safer, to streamline healthcare, make it more efficient, to provide evidence of what healthcare interventions work and which ones don't work. That will ultimately affect the efficiency as well as the efficacy of our healthcare system. And then, one theme in these staffing reductions is the elimination of offices and agencies dealing with racial equity and disparities. And that has certainly been something that's come under assault in this administration.
Let's try to keep an open mind and give the current cuts their due for a second. We know that one of the main drivers of healthcare costs is administrative spending, accounting for about 15 to 30% of healthcare spending. So are there any ways that the moment might create space for streamlining of healthcare administration, reducing costs for patients?
I think there are some hopeful signs. So, for example, we have seen insurance companies scale back some on prior authorization, the approval a patient and clinician has to get before a service can be provided. This has been a huge frustration for both physicians and patients and eats up administrative costs on both ends. Administrative costs in the physician office to deal with this constant back and forth with insurance companies over prior authorization, and administrative costs on the insurance end. So we've seen some moves to scale back prior authorization from some big health insurance companies. I also think there's some potential for AI to streamline administrative costs. So, for example, in prior authorization, there's, I think, concern that AI algorithms doing prior authorization will lead to more denials of care, but I think also some potential for it to streamline the system, lower costs, and we're seeing AI being used on the physician end as well to help appeal some of the denials in a more efficient way.
Let me try to find the positives in the moment. So public health has grappled with this challenge that has been posed largely by the political right in this country to challenging federally subsidized healthcare. So it's worth asking why. Why is there this constant push from the right side of the political spectrum to make cuts to federally subsidized healthcare? What's the strongest conservative case for doing so?
Well, I think a lot of the push to reduce government spending on subsidized healthcare comes from an ideological perspective to reduce federal spending, not only in healthcare, but in other areas as well. But I think it also comes from a really different view of these government health programs. The left tends to view these programs as a stepping stone towards universal coverage, which we, of course, don't yet have in the United States, but have tried to create a patchwork to get as close as possible through programs like Medicare, Medicaid, and the Affordable Care Act. Conservatives tend to view these as welfare programs that are only for, or should be only for, the deserving poor. And we're seeing that play out, I think, in the current debate over Medicaid, that the expansion of Medicaid under the Affordable Care Act to low-income adults, including those who don't have kids, is viewed as for able-bodied people who don't necessarily deserve government assistance. Similarly, the idea to add a work requirement to Medicaid is this idea that only people who are working and deserving of assistance should get it. So it's this kind of clash of worldviews of how you view the government's role in the healthcare system.
Yeah, I appreciate how you framed this around ideological differences, because it's hard to understand otherwise some of the concrete actions without that. Let me ask one more question that tries to take the administration at face value. So I think this administration has shown a willingness to be disruptive and to pursue its goals. So let's imagine for a moment that these goals include serious health reform in this country. So what are some disruptions that could actually bring about positive change? How might an administration implement them? And maybe even stepping outside the realm of big disruptions, what are some simple changes we could make to improve the system we currently have?
One thing we've seen from this administration, from RFK Jr. as the new Secretary of HHS and the Make America Healthy Again movement, is a focus on chronic disease. And of course, we do have a chronic disease epidemic in this country, and the drivers of chronic disease that lie outside of the healthcare system. So things like healthy food, healthy eating, healthy behaviors are certainly a driver of obesity and chronic diseases. I think we're in a moment where there's at least the potential for the left and the right to come together and think creatively about how we address chronic disease. I would hope that that gets broadened beyond simply food and healthy behaviors and addresses things like poverty and racial equity as well, which may end up being more politically controversial. But I think we're at least in this moment where there's the potential to focus on some of the drivers of our poor health in the U.S. and how to address them.
So let's say for a moment that we have our attention, we're focused. So what should we be talking about when we talk about healthcare? How should advocates for more generously funded federal engagement with this moment engage with, and what should we be doing to lay the groundwork for a better health system?
I would come back to some of the issues I talked about earlier. So affordability. We have to get the cost of healthcare down in the U.S. generally, and to make it affordable for individuals, particularly low-income individuals. And I do think we need to broaden the discussion beyond the healthcare system. It's important to make the case that healthcare is important, both for financial security and for health. But so much of what affects our health lies outside of health insurance and outside of the healthcare system, and we need to recognize that as well.
Thank you, Larry. I'm Dr. Sandro Galea. I have been speaking with Larry Levitt. We have been talking about challenges and opportunities for U.S. health reform in this moment. You can find a link to articles by Larry and myself on these topics in this episode's description. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com, jamahealthforum.com, or look for JAMA Network wherever you get your podcasts. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.